Types of urinary incontinence. So first of all I will talk about overflow incontinence. Overflow incontinence, its mean overflow. So there will be a chronic urinary retention. Mechanism will be chronically distended bladder. So remember, distended bladder with increased intravesical pressure that just exceed the outlet resistance, allowing a small amount of urine to dribble out. So remember, overflow will be small amount of urine to dribble out. So what we do in this, we place the urinary urethral catheter in acute setting, and we treat the underlying causes, and also we make a diary urinary analysis, or you can say urinary output. We check the time voiding, we make a diary and note it down when a patient is urinating. So for the urge, the patient is trying to urge, unexpected urge to void that unrelated to position or activity. So here you will talk about patient is unexpectedly urge to void. So here will be a mechanism will be detrusor, hyperreflexia, or sphincter dysfunction due to inflammatory condition or neurogenic disorder of the bladder. So here you need to remember, for the urge there will be inflammatory condition, neurogenic disorder, or there will be a reflex problem. So here will be hyperreflexia of the detrusor muscle, and or also sphincter dysfunction. So in this case we need to treat it with the medications, like for the you need to remember that sympathetic system lead to urinary retention, and parasympathetic condition, which is cholinergic, lead to urination or pee. So we have to stop the urination by giving anticholinergic medications. TCA will be tricyclic antidepressant. Behavioral trainings will be there. So the third type will be stress. There is any stress in the which increase the intra-abdominal pressure, like coughing, sneezing, lifting. So urethral sphincter insufficiency will be there due to laxity of pelvic floor musculature. Muscles will be weak, so common in multiparous women or after pelvic surgery. So in this case you need to ask the patient to Kegel exercise or pessary. Vaginal vault suspension surgery will be there. Total, you just remember, total will be loss of all times in all positions, uncontrolled loss. So there will be loss of sphincter deficiency. So patient may be previously gone through surgery, nerve damage, cancer infiltration, abnormal connection between the urinary tract and the skin. So there will be a fistula. Here we need to do surgery. So just to I'm gonna give you an overview again. Overflow, you need to remember, chronically distended bladder. So there will be a dribble out. For the urge, patient is unexpectedly urge to void. So it could be a three problems: sphincter dysfunction, inflammatory or neurogenic disorders of the bladder. So urge condition, we manage this patient with medications. For the stress, we just think about it, the patient has the urinary incontinence by having coughing, sneezing or lifting. So you have to ask the patient to Kegel exercise, or there is also a surgery called vaginal vault suspension surgery. Total, you just need to do surgery. So for here is A and B. For the urge, etiology include inhibited contractions, local irritation like cystitis, stone, tumor, and CNS causes. Here you just remember about neurogenic and all inflammatory and hyperreflexia conditions for the urge. But for the overflow, you need to remember there will be a physical agents, tumor or stricture, neurological factor, lesions could be there, and medication problem. Thank you very much.